welcome to EA News. My name is Emily Quevedo, and today I have an interesting story for you all. A recent case of Poland syndrome has been discovered in the valley. This is only the 5th case that has been documented in history of our small town. Now, I'll cut to my co-anchor Alexis, who is reporting across town.
Hello, my name is Alexis Alzada, and I'm currently reporting across town. Many people are not familiar with Poland syndrome, which is not surprising considering it is a rare disease. According to the National Human Genome Research Institute, Poland syndrome is a disorder in which there is an underdevelopment or absence of the muscles on one side of the body and a webbing of the fingers, 2012.
Now, I read in my papers that this syndrome has a chance of affecting 1 in every 20,000 births, according to Genetics Home Reference 2016. This makes it very rare and no certain causes for this disorder are known. I've also read here that according to National Center for Advancing Traditional Sciences, Poland anomaly is more common in boys than in girls, and the right side of the body is typically affected twice as often as the left. My readings also include that there are many symptoms that can be used to help diagnose this disorder.
You're absolutely correct, Emily. There are a number of physical disabilities that are characteristics of Poland syndrome. As mentioned on the National Organization for Rare Diseases, some of these symptoms are apalasia or absence of the main chest muscles, synodactyly or abnormally short webbed fingers, absence of the main chest muscle, absence of auxiliary hair, and the absence or underdevelopment of an areola, which in females can also affect breast development and tissues, 2007.
You mentioned this disorder is rare. How are people diagnosed with Poland syndrome, or how do they know they have it?
Well, Emily, Poland syndrome can be diagnosed as early as birth and as late as puberty depending on the severity of the case. According to the National Human Genome Research Institute, to make an official diagnosis, clinical tests and evaluations can be used. Some of these tests include CT scans, MRIs, and X-rays. CT scans can be used to determine the extent to which muscles are affected, and X-rays can be used to identify any abnormalities in the hand, ribs, or shoulder blades. When a person experiences a mild case of Poland anomaly and is diagnosed when puberty occurs, it's usually because puberty causes the differences in the two sides of the body to appear more obvious. This is especially typical for females who have a mild case of this disorder.
Boy, does that sound scary. But don't worry, folks, there are treatments for this disorder. The main treatment is to get reconstructive surgery. According to Amir Tahirna, MD, FACS, Plastic Surgery and Recovery, males should consider getting surgery when they are about 12 to 13 years old. The way they do it is they make a small incision in between your back and armpit and take out the ipsilateral latissimus muscle and insert it to where there is a missing pectoralis major muscle. If the latissimus muscle is missing, then the alternative is to transfer the patient's own fat harvested from the abdomen or the flanks and into the chest area. If the case is too sensitive, then another option is to get implants. Now, let's talk about the female's options. When a female has Poland syndrome, it is important not to get the surgery too early. If it is performed earlier than it needs to be, then asymmetry may occur and one breast will be noticeably larger than the other. When this happens, a secondary procedure must take place once the breasts have fully developed. If the patient still decides to get the procedure done early, then it is best to get a temporary expander so that there can be additional reconstruction. The expander gets placed under the skin and is inflated to match the unaffected breast. The expander allows the skin to expand so it can be adjusted for the latissimus muscle and the implant. The expansion can make the nipple areola complex bigger, but that can be fixed with tissue expansion or strategic tattooing. Tissue expansion can be performed with a temporary tissue expander that eventually gets replaced with a permanent implant or a permanent implant expander. The most popular implant expander is the Becker implant, which contains silicone gel and saline. At ages 18 to 19, the tissue expander can finally come out, and the breast can be reconstructed with a latissimus muscle transposed or a permanent implant.
Wow, how fascinating. You know, I was doing some research to see if it's genetically transferred, but guess what? It's not. Scientists have not yet confirmed the cause for this disorder. Plus, in most cases, the people who have Poland syndrome do not have any relatives that also contain it. Here's an example of how it would look like on a pedigree. As you can see at the top, the grandparents are perfectly healthy as well as the parents. The parents happen to have a child who inherited this disease, which scientists aren't really sure how. Scientists are centering their research on inherited mechanisms dealing with intra-uterine reduction flow to the affected areas such as the chest. Hey Emily, do you know what body system Poland syndrome can affect?
Well, as a matter of fact, I do, Alexis. Poland syndrome mostly affects the muscular system. For those of you who don't know, the muscular system is composed of the cardiac, smooth, and skeletal muscles according to Wise Geek. Here is an example of the muscular system. These muscles help organs function properly, circulate blood, and allow movement to occur. The cardiac and smooth muscles are activated involuntarily, where skeletal muscles are not. Most of the components in the muscular system are skeletal muscles. Those help you stand up straight and keep your posture so you won't fall down. They're essential to the most basic movements, such as moving your finger or stretching out your leg. The skeletal muscles also help maintain your body's temperature, and it supports soft tissue. The way it maintains body temperature is that it releases heat. Certain skeletal muscles act as support system and shields to protect vital organs from getting hurt, such as the heart. Cardiac muscles are also important in the muscular system. Heart muscles are essential because it facilitates all blood flow throughout the entire body. Now, Alexis, I'm anxious to know which organ is affected by this disorder.
Well, now that you mention it, Emily, the heart is an organ in the muscular system that is affected by Poland anomaly. A sign of the syndrome that is connected to the heart is dextrocardia. Dextrocardia occurs when the heart is located on the opposite side of the chest. Dextrocardia is complicated because some people can live a healthy, normal life while others can't. If a person has dextrocardia and Poland anomaly, it can lead to heart complications.
Aw man, that's unfortunate. Now, for those of you thinking whether or not treatment can affect the muscular system, well, worry no more. I have all the information you need. Although reconstructive surgery does sound great, it does have many cons. One is that if the latissimus muscle is used too early over the tissue expander, then the muscle will become thinner within time. Another con is that the patient might develop a unilateral contracture to the breast processes and can result in uneven breast once again.
Well, folks, there you have it. You are now well informed about this interesting but treatable disorder, Poland anomaly. That's the time we have for tonight. Thank you for watching, ladies and gentlemen. Tune in tomorrow at 5 p.m. Eastern Time, where we'll talk about dogs and cats. Thank you. Good night, everybody.